my name is Heather and I'll be performing a newborn assessment today for you guys. So the first little tip, you always want to try to keep your newborn as covered as possible as they can lose their body heat very easily. Our first assessment is going to be the APGAR assessment. So this consists of our activity, pulses, grimacing, appearance, and respirations. Each of these 5 sections gets a score of 0 to 2. And we're doing this APGAR assessment at 1 and 5 minutes, and we really want a score of 7 to 10, which indicates a good outcome of the infant. So next, we can go ahead and take a look at our reflexes. The first reflex that we have is the rooting reflex. So you can go ahead, stroke the baby's cheek, and this will elicit a response for the baby to turn its head and open its mouth towards the side that the cheek was stroked. Next, we have our sucking reflex. So you can put a glove on and you can just stick a finger in the infant's mouth and they should start sucking. The next one is going to be our Moro reflex. So this is also known as the startle reflex. And you can just hold your infant up and just let go a little bit, and they should have symmetric startle on both sides. And then after that, we have our tonic neck reflex. So once you turn the infant's head one way, the way that it's turned will be extended, whereas the opposite side will have flexion in both extremities. After that, we have our gallant reflex. So for our gallant reflex, we can hold the infant and you just stroke on one side of the spine and the infant should move towards that side. If not, it could indicate a spinal cord problem. After that, we also have our palmar grasp reflex. So you stick your finger in the infant's palm and they should grasp your hand. In addition, we have our stepping reflex where you hold the infant up just lightly on a hard surface, and then they should start making that stepping movement. Then after that, we also have our Babinski. And for the Babinski, you just take your finger and stroke it up the side of the foot, and it should have that outward fanning of the toes. So those are our reflexes. They indicate the neurological status of the infant. Next, we're going to go ahead and weigh the infant. So when you're weighing an infant, you always want to make sure that you put the cover on first and then 0 it. Then you can place your infant on the scale, making sure that you stay there so that the infant doesn't fall off, but don't touch it as that could affect the weight. After that, we can go ahead and measure our infant. Take a tape measure. You're measuring from the crown of the head all the way down to the heel of the foot. So some nurses, they'll even just make a mark at the head and make a mark at the foot, at the heel of the foot, and then they can measure those marks that they had made on the bed. In addition, we're going to measure the infant's head circumference. So you're measuring it just right above the pinna of the ear and along that inner caneus of the eyes, that symmetrical line. Then we can go ahead and measure the infant's chest circumference, and that will be just at the nipple line that you check for that. So after that, you can check their vital signs. And infant temperature is the same as adults, so 97.7 to 98.6 is the normal. Their heart rate should be anywhere from 110 to 160. Their respiratory rate should be 30 to 60 breaths per minute. Blood pressure is rarely taken, but sometimes they'll take it if they suspect cortication of the aorta. So they would do this in all 4 extremities. Normal systolic blood pressure for an infant or for a newborn is 50 to 70. And pain, you're assessing that too. Just make sure that they're not irritables because they can't speak to say whether they're in pain or not. Their overall skin, you're just looking to make sure that it's nice, supple, normal in color. Cap refills are good. And there's a couple things like Mongolian spots. It might be like a bluish discoloration. This is actually normal in Asians, African Americans, and Hispanic babies. So there's also the spider nevis, which is a benign little spot that's blanchable, and that's normal as well. And some babies will get just a little red spot back here, and that's called, they call it stork bites, but they're also called the macular stains. So you might hear either of those terms. In addition, you want to take a look at their head and neck. Make sure that it's nice and symmetric. On the head, the anterior fontanelle will be open. It will stay open until 9 to 18 months, and the posterior fontanelle should be closed by 3 months. So you're looking at their fontanelles. If they're sunken, that could indicate dehydration, whereas if they're bulging, that could indicate hydrocephalus, which is an increase in cerebrospinal fluid. Sometimes when they cry, though, they'll have just slight bulging, so that would be considered normal. You're also just checking the overall range of motion, just to make sure that the infant has nice range of motion. Just move their head and neck up, move their arms just a tad. When you're looking at their eyes, you want to make sure that their scleras are white, conjunctivas are nice and pink. You're looking to see that their pupils are equal, round, and reactive to light. So you can go ahead, take your pen light, and you want a nice brisk response with no pinpoint pupils. And after that, you're going to look at their ears, check the placement. So the placement of their ears, the top of the pinna should line up with the inner cameus of the eyeball. And then after that, you're going to go ahead and look in their nose, make sure that that's nice and patent. Then you're going to look at their mouth, make sure that it's nice, pink, and moist. Take a look at their throat, and there's no discharge or anything. Then you can also look for nasal flaring. That could indicate signs of distress for the infant. Next, you're going to go ahead and you can listen to the lungs. So infants are abdomen breathers, so you're mostly going to see their respirations in their abdomen. And so you can go ahead, you want to inspect their chest. At this time, you can also be looking at their nipple line, making sure that those are symmetric in the right spot. Some may have an extra nipple, which can be considered normal. So, just like you'd listen on an adult, you're listening to the front in a few spots. You'll listen to the back. And also the sides, the other ones. And just like an adult, you don't want to hear any wheezes or crackles, as those are still considered abnormal breath sounds. And also, when you're looking at your infant, circumoral cyanosis can be normal, and that should go away shortly. But if the baby is cyanotic all over, then that's a problem, and that means that they have poor oxygenation status, and it could indicate a congenital heart defect. So you would want to get that checked out as soon as possible. Also, if the baby's pale, it could mean that they're anemic. Next, we also have the heart. So you can palpate at the point of maximal impulse. Palpation may be hard. You can also listen. And if you're listening again for S1 and S2, some murmurs may or may not be abnormal, so you would want to check to see which ones are and which ones aren't. And at that time, you're also going to check their pulses. So you want to check brachial and femoral pulses. Make sure that those are nice. Always checking both sides at the same time to make sure that they're equal. And you're looking at their range of motion, which you're kind of assessing the entire time. So you can use your ortolanis, which you would want to take your finger, put it on the greater trochanter. I'm doing this on both sides. And kind of lift up and out, and you don't want to hear clicking noise. Clicking indicates that it's abnormal. So for this, we're checking for hip dysplasia, making sure that there's none of that. Also, you can do the Barlow, which I don't think they recommend too much anymore, but you would push down and make sure that it doesn't pop out. Then You could look at their gluteal folds. You want their gluteal folds to be nice and equal. And if they are unequal, it could indicate hip dysplasia. So again, you're just looking at their neuro status, which you're checking to see how they react to loud noises and just the reflexes that we had checked before, making sure that they're blinking correctly. And after that, we want to take a look at their genitals. So if they're female, you just want to make sure that that hymen isn't covering the vagina. And if it is, they'll just need a small surgery just to get that taken off. And you want to make sure that there's no lesions down there, any foul smells you would want to note. And then also, if it's a boy, you want to look at the urethral meatus. You want to make sure that it's nice on the top of the glans venus, not on the bottom or anything, and you want to make sure it's nice and symmetric, and no edema and no masses. And you also, if they have the foreskin on there, you can go ahead and retract that. Make sure that it's retractable. And you can also feel their testes, and you want to make sure that both testes are descended bilaterally. And last, you just kind of want to take a look at the anus, and you can palpate it. You just want to make sure that the anus is patent and that stuff will be able to come out when it needs to, and that there are no pinworms or anything draining from down there. And that's it.